Avian patients are usually not measured with a caliper to calculate the exposure. Normally, exposure factors are chosen according to the species and size of the patient. Following Table 20-1 in our radiology textbook, a setting of 64 kV and 20 MAS was selected. This was somewhere between the settings for an eagle and a trumpeter swan. Our subject weighed 10.4 pounds. Physical restraint for an avian X-ray is preferred. However, since this patient is deceased, we were able to tape it down. The bird is positioned on its back so that the sternum is superimposed over the spine. The wings are fully extended laterally, in full extension, and secured with tape. This was a bit difficult to do since our specimen was deceased and some rigor had set in. We extended them as far as I was able. The legs were extended caudally as far as possible, positioned as symmetrical as we were able to, and also fastened to the table with tape. The neck is gently extended in a cranial direction and is also secured with tape. This was a pretty large bird, so I was not able to collimate much past what you see here. You'll want to make sure that the center of the beam is centered midline at the caudal tip of the sternum. For the lateral view of the whole body, the bird is placed in right lateral recumbency. The wings are extended dorsally directly above the body of the patient. The wing that is down on the table should be positioned more cranial than the upwing and positioned with tape. You also want to use the tape again to extend the legs caudally and position the tape to the table. Again, since this patient was deceased, it was a little bit more challenging to try to get the wings to stay in the position that we wanted them to be. You want to make sure that you have the beam center placed over the middle of the body between the spine and the sternum. You also want to make sure that you have the correct marker placed in there, and you also want to make sure you have some tape over the jaw of the bird.